by your glory.
Good afternoon, everyone. I'm Faith Colas, Director of Advocacy Outreach and Community Affairs. On behalf of Dr. Eve Hall, CEO and President of the Greater Milwaukee Urban League, welcome to our inaugural Conversation Wellness, a series that will inform you and keep you connected to the ongoing work of the Greater Milwaukee Urban League and the work community partners. The Conversation series will cover a wide range of topics, including but not limited to health, home ownership, employment, financial literacy, education, entrepreneurship, voter education, and family. Our goal is to empower communities and change lives. Before I begin introductions, let me remind you to keep your microphones muted. We will be recording today's series, so if you have to leave us for any reason or want to share today's session with others, we will be posting today's presentation on our website at tul.org, on social media, and our page. When we open the session for questions, please feel free to place your questions in the chat. Now, at this time, I'd like to introduce our sponsor for today's Conversation Wellness, Kurt Heminger. Kurt directs marketing and community partnerships for iCare. He joined iCare in April 2017. In addition to over 14 years of insurance experience, he also has experience leading marketing and lead generation in the technology industry and began his career as a copywriter, advertising, and graphic design agency. He has a journalism degree from the University of Wisconsin, Eau Claire. Current responsibilities include leading a talented team of individuals to implement branding, advertising, and lead generation. Please join me in welcoming Kurt Heminger.
Thank you so much, Faith. Really appreciate having the opportunity to be here. For those of you that may not be familiar with iCare, iCare has been part of the Milwaukee community since 1994. Just last year in 2021, Humana increased their ownership stake in iCare, and now we are a wholly owned subsidiary of Humana. So that is bringing with us some new exciting opportunities. It's been great working with people like Faith, like Florida, and like Dalvari Blackwell, who you'll be hearing from later, who we've worked with in the past and is a fabulous element of our community. So the question some people may have is, why a health insurance company? Why are you involved with this community conversation? Well, because healthy birth outcomes are a huge issue in the state of Wisconsin, particularly in Milwaukee. It's a big issue for the state of Wisconsin. It's the big issue for Humana, our parent company, and it's a priority issue for us as well. I'm going to leave you with two statistics here, which I think are a little bit stark. Number one, in the city of Milwaukee, the preterm birth rate is 13.8%. That's the second worst in the country, tied with Detroit. When you look more broadly at the state of Wisconsin, it doesn't get a lot better. For Black women in the state of Wisconsin, they're 5 times more likely to die in childbirth or related to childbirth complications than non-Black women. That's not acceptable. There's going to have to be a lot of different things that are going to have to change to truly solve this problem. And we won't solve it today, but being involved with organizations like Greater Milwaukee Urban League and like African American Breastfeeding Network take us a long way. So thank you for involving me, and I turn it back over to you, Faith. Thank you very much.
Thank you, Kurt, and also thank you to Humana and iCare, the entire team, for your support of the Greater Milwaukee Urban League and our ongoing efforts to empower communities and change lives. Now, please join me in welcoming our speaker, Dalvari Blackwell, who is the Executive Director and co-founder of the African American Breastfeeding Network. She is a national board-certified lactation consultant and holds a bachelor's degree in journalism and communications. The African American Breastfeeding Network was established a decade ago to improve maternal child health and champion breastfeeding equity. The organization is committed to advancing systems and policy changes, partnering with allies, and implementing community-based, family-centered, culturally tailored health education and support services. Through Dalvari's leadership and vision, the African American Breastfeeding Network has built eminent goodwill in the community. The organization has been recognized, highlighted in local, state, and national. April 2015, Essence Magazine 10 Things People Are Talking About. In January 2015, recognized by the Associated Press. The 2014 CDC Breastfeeding Report Card, and the 2014 Black Child Development Institute, a report on being Black is not a risk factor, statistics and strengths-based solutions. Dalvari has been instrumental in creating and building the African American Breastfeeding Network's core program, Community Breastfeeding Gatherings, which is seen as a national model. She received the 2017 Women of Commitment Award from the Wisconsin Alliance for Women's Health and recognized by the Milwaukee Community Journal in the category of the 2018 Year of the Child, a Game Changer honoree. In 2021, the organization won a national competition for breastfeeding innovation issued by the Office of Women's Health. Dalvari is the recipient of the 2021 Wisconsin Public Health Association Award for Excellence in Health Promotion and Disease Prevention. Her alliances with community leaders and institutions has coined her champion for family-centered health. And finally, in 2022, the African American Breastfeeding Network was a recipient of the Top Prom Mom Workplace Award by Working Moms of Milwaukee. Please join me in welcoming Dalvari Blackwell.
Good afternoon, guest, and I'm so honored to be in this space this afternoon as one of the first presenters of the Greater Milwaukee Urban League's Wellness Series. And I would also like to take this opportunity to acknowledge the sponsor of these series, Humana Eye Care. I first, and Faith, thank you so much for the warm introduction and for sharing a little bit about me. There is a couple more few disclaimers that I would like to share with our guest today. Can you go to the next slide, please, Shanab? Thank you so much. So first of all, I am not a doula. I just wanted to make sure I share that. I am a champion of holistic and traditional birth practices. I embraced my first non-intervention birth in a hospital setting, and I had a doula. Also, my second birth, I had a home birth at home, and it was an amazing experience. I used my lived experiences as a leader of the African American Breastfeeding Network to guide my work and to inform my work as well. Next slide, please. So the discussion goals for today is number one, I would like to define maternal and infant mortality. which is the public health crisis we find ourselves in at this time. And I would like to also define doula. What is a doula? Share the benefits of a doula-assisted birth, share recommendations to address inequalities in healthcare, and also highlight the efforts that we're doing at the African American Breastfeeding Network to support birthing people. Next slide. I'm actually going to skip this slide about the AABN because Faith shared the mission of the organization, and we was established in 2008. Next slide, please. I would like to start my presentation describing what cities and Black and Brown neighborhoods across the country are embracing and what I and others call the Black birth renaissance. Here you see the powerful, the beautiful African symbol from the Akan tribe in Ghana, the Sankofa bird, which is very familiar to a lot of people and individuals in the country. The bird literal translation of the word and the symbol is, it is not taboo to fetch what is at risk of being left behind. Our Black birth workers, our doulas, our midwives, and reproductive health advocates are embracing the traditional birth practice of healers who were systematically discarded and banned during the middle of the 21st century. Black birth workers have evidence of what we have always known to be true, that certain practices save lives and improve birth outcomes for mom and baby. These birth workers are sounding the alarm about the need to pursue research on Black maternal health to ensure African American women have access to adequate reproductive health services, and fund and support community-based led models of care, empower Black mamas to share their concerns and their experiences, to lift and acknowledge their voices in this space. Black women of childbearing age. Yes, I'm sorry. Okay. Can everyone hear me okay? Okay. Black women of childbearing age and Black elders are participating in fueling for decades the Black Renaissance, and they are here to stay. The pandemic elevated socioeconomic injustices and exposed disparities of COVID transmission and death. Also, COVID-19 shed light on the need and the necessity for birth workers or doulas, I'm going to use those terms interchangeably, to be a part of the hospital system and the need for them to be in hospital settings in particular. Next slide, please. Our community mother you see in this picture is Zakia Courtney. This is one of my favorite pictures. Mother Zakia Courtney, she facilitates our Lift Up Every Baby annual event. And this is the picture that we took last year in this photo. And why I'm showing this picture is because Mother Courtney also often reminds us that we are equipping ourselves to help ourselves, to heal ourselves in order to save ourselves. Before there were doulas, there were mothers, grandmothers, aunts, sisters, and friends who supported mothers during their childbearing years. It's important to remember this, and that birth workers and midwives were always ready. And they are reclaiming, as I mentioned before, and embracing what they have always known to be true, that Black women and families can empower ourselves to improve birth outcomes. Black doulas are redefining themselves in this space. They provide continuous physical, emotional, and information support during pregnancy, during childbirth, and during the postpartum time. They are trained non-medical professionals providing a priceless service. Black doulas tend to use a very holistic approach in their work. Can you go to the next slide, please? The reason why I'm showing this slide of holistic birth equity, because it beautifully depicts what birth workers, how they approach the work in the community. This particular graphic I retrieved from Birthing Beautiful Communities. It is a nonprofit community-based doula organization in Cleveland, Ohio. You notice that pregnancy and postpartum support and care are part of the holistic birth equity model, right? But also housing, preconception health, education, business, justice, and so on. Of course, maternal mental health as well. So independent providers and group-based collective groups design services and strategies designed to address some of these social determinants of health that can definitely impact maternal and infant mortality rates. Any and all of these drivers of social determinants of health impact the outcomes, right? So however, we know that racism and racist practices is at the hem of maternal mortality in America. Now I want to turn our attention to infant mortality. We're going to be talking about this a little bit. Can you please go to the next slide? So many of you probably know one or two babies who have died this year or even last year. The problem is that the rate of 16.5% has been consistent for the last 5 years. Infant mortality, I remind some of you in this space this afternoon, that infant mortality is the number of infants who die before their first birthday, and is measured by the infant mortality rate, which is the number of infants' deaths per 1,000 live births. We often use infant mortality and maternal mortality for that fact as a general measure of the status of babies' health and well-being. Milwaukee County infant mortality rate is 16.5%, and Black babies are 3 times more likely to die before their first birthday than white babies. Next slide, please. I want to just shed light and point out where our Black babies are dying. They're dying in 5 zip code areas in Milwaukee County, or in the city of Milwaukee, I should say. I grew up in zip code 53206. We still have our family home there. My mom still lives there. And the other zip codes are 53216, 5310, 53208, and 53209. These are the 5 zip code and neighborhood areas that have the highest infant mortality, and that has been pretty persistent over time. And also we know that these neighborhoods have the poorest health outcomes for Black and brown people. The neighborhoods are riddled with violence, police brutality, underemployment, healthy food deserts, inadequate medical resources, etc. Next slide, please. I wanted to show the city of Milwaukee infant mortality by race and ethnicity and the trends of infant mortality from 2010 through 2008. This particular slide shows a rolling 3-year periods. For example, we see 2010 through 2012, and then we see 2011 through 2013. The orange bar represents the white or Caucasian population. The tan represents the Hispanic or the Hispanic population. And you'll probably guess right. The maroon bar represents, the maroon color represents us African Americans. And as you can see from this chart, from 2013, infant mortality decreased to 13.7 for Blacks. So roughly 13 babies out of 1,000 births died before their first birthday. However, when you look at 2016, infant mortality has been increasing since that time. And as I mentioned before, Milwaukee infant mortality rate is 16.5%. So you can see the health disparities. And again, what I truly want to make sure I point out is that we have not, as a state, as a city, we have not been able, unfortunately, to reduce infant mortality. Next slide. The largest contributing factor of infant mortality is prematurity. Babies born before their 37 weeks are considered premature and may be at risk for other complications such as low birth weight, breathing problems, heart problems, and cognitive problems as well. Of the 309 infant deaths during this period of 2016 and 2018, 49.2% was because of prematurity and is the highest percentage with Black babies. The number on contributors in prematurity is maternal stress, for example, can cause prematurity. And as we know, inequality in treatment and of pregnant women that they experience in our healthcare system. I want to use this time to transition to talk about breastfeeding because that was the mission of our organization while we started a decade ago. But I just want to take a few minutes to talk about breastfeeding, especially in the light of the formula shortage. Next slide, please. So here you see the value of mother's milk. And I want to pause a moment to just share the lens in which we address and uplift this space around breastfeeding is that we use the terminology breast milk often, the value of breast milk. First of all, to acknowledge that 90% of Black moms are going to use a pump to express breast milk because they're going back to school or work. And then also because of the stigma and the misinformation related to breastfeeding, when we first started AABN, many of the women that we worked with felt that breastfeeding wasn't for them because they were going back to work and or school. So we began to use the terminology breast milk instead of breastfeeding. So here you see some of the benefits of mother's milk. And I'm not going to go through them because of the sake of time, but it's endless, the value of breastfeeding and providing nutrition for infants and children. Can you go to the next slide, please? So unfortunately, we find ourselves in a formula crisis. But I do want to highlight that honestly and realistically, our country, because of the pandemic, has been in a shortage crisis of almost everything. So anything, commodities and products that we can think of, there's been a shortage, right? So for example, if you are purchasing a new appliance and there may be a missing part, you can't purchase the appliance because the missing part may be in shortage. But there's also a labor shortage as well. The other important thing to point out here is that the formula crisis affects disproportionately the BIPOC community, Black and Brown Indigenous people of color, because we're more likely to not have access to lactation services in the community in which we live. We are less likely to have awareness of the value of mother's milk, for example, and returning to work environments that are not supportive of breastfeeding and expressing milk. This is a perfect opportunity to promote exclusive breastfeeding. And Black women do breastfeed, but the rates are disproportionately lower in comparison to other ethnic groups. What we do want to focus on is exclusive breastfeeding and breastfeeding longer duration. This is also a perfect opportunity to educate the community and families around resources available, and also advocate for legislation and policies that protect the right to breastfeed in public, and the right to breastfeed at work with the reasonable break time for nursing mothers, which is a federal law. And also, it's important to make sure that families are and providers and the community leaders are up to date on the research and recommendations for formula usage. For example, my organization and myself are not advocates of families making and concocting their own formula. There are recommendations that we can share from CDC, for example. So just wanted to share that, and we can definitely have questions available for anyone that has a particular question around the formula crisis in breast milk. Next slide, please. So going on to what is maternal mortality. The maternal mortality is first a pregnancy-related death. It's the death of a woman while she was pregnant or within 1 year of pregnancy termination, either through birth, miscarriage, or elective abortion. Any cause related to or aggravated by the pregnancy or its mismanagement is called maternal mortality. Black women are 4 times more likely than Caucasian or white women to die during childbirth. And in Wisconsin, our maternal mortality is 5.9%. And as you can imagine, of that, 5% are Black women. Let's magnify this issue a little bit. Can you go to the next slide, please? So Black women have a number of health disparities and inequalities, as we know, and I just wanted to highlight a few that's relating to reproductive health. A Black woman, for example, is 22% more likely to die from heart disease than a white woman. She's 71% more likely to perish from cervical cancer, and 243% more likely to die from pregnancy or childbirth-related causes. Can we go to the next slide? So evidence points to structural racism, quality of care, provider bias issues, and the lack of a comprehensive reproductive health, maternal health services available in neighborhoods. These are all drivers of maternal mortality. So we know that the social issues that leads to maternal mortality, I just want to briefly talk about some of the actual medical causes, as well as we can see from this slide. The 3 leading causes of pregnancy-related deaths are cardiovascular diseases, so heart disease at 13.5%, and then cardiomyopathy at 12.6%, and also hemorrhaging at 11.9%. It's important to note that regardless of socioeconomic status, college degree or not, Black women are still 5 times more likely to die from complications during birth than similarly educated white people. So birth companions or doulas, or you want to say birth workers, have been around for centuries. They cannot eradicate maternal and infant mortality, but they sure can, and there's evidence pointing to that they can improve the health status of mom and babies, and communities are asking for birth workers and doulas to be by their side. Next slide, please. Let's talk about what is a birth worker. Let's define who they are. I mentioned earlier that a birth doula is a non-medical trained healthcare professional. She provides continuous support physically, emotionally, spiritually, and informational. She offers services to expecting families through their pregnancy and up to 1 year after birth. Some programs go up to 2 or 3 years supporting mom and baby and family. Doulas tend to work together with the medical team as partners. They offer education to the families so that they can better advocate for themselves. They offer education so that families understand the birthing process, but more importantly, their rights as a birthing person in a hospital setting. They also help prepare families for what to expect in labor and after the baby is born. I just want to pause here too to share that some doulas go a little bit beyond this description to actually provide other services such as light housekeeping, washing dishes, or folding clothes, or doing laundry. They may also often pick up groceries or a meal for the family as well. So their work, in my opinion, is priceless. It's simply priceless, the support that they provide to our families who are faced with the medical system because of that's racist and has changed because of COVID-19. I want to go on to share a few statistics of the value of doula-assisted births. As you can see from this graphic, there's many benefits that women receive when they are birthing with a doula and have a doula by their side. We see a 9% drop in the use of pain medication. We see a 30% less use of Pitocin and 34% fewer negative birth experiences, or women have very positive birth experiences and express positive experiences with their doulas. Also, women experience a 40-minute shorter labor when they have doula support. And what's really important is that, as you can see, that was much larger, is that 28% have fewer C-sections. Women who birth with doulas are 12% more, have 12% more spontaneous vaginal births, for example. The babies have higher Apgar scores, and of course, increase in breastfeeding initiation, exclusivity in breastfeeding during immediately after birth and during the postpartum period. Can you go to the next slide, please? So let's turn our attention to some of community-generated and evidence-based solutions to support better health outcomes for our Black and Brown communities. One of the solutions is to expand and support and fund birth options, right, such as doulas and midwives and home births, for example. Support group prenatal care visits, which has been shown to have positive outcomes for pregnant women. Also advocate for Medicaid postpartum care expansion. Right now, a mom who is receiving Medicaid is only eligible for 2 months of postpartum care. And so locally, our elected officials and nationally, there's legislation asking for and recommending 1 year postpartum care for mothers, that they're supported up to 1 year. Also, we need to make sure that we continue to create workforce diversity, cultural competency, and implicit bias training, and then support community-based programming and models such as the African American Breastfeeding Network. I want to now share, can we go to the next slide? I'm going to share a little bit information about our 3 core program areas. I'm very proud of Healing Waters. Healing Waters is our response to the infant mortality crisis and how we can support families who have lost infants either while pregnant or after up to 1 year of age. Our sessions are facilitated by an end-of-life doula who is also a nurse, Chantel Riley. We have started our in-person sessions and hosted by Sojourner Family Peace Center. Chantel also provides phone counseling, in-person counseling, and family counseling as well when people find themselves with an unfortunate loss. And then I also want to mention our community breastfeeding gathering, which Faith mentioned at the beginning of our conversation today, that the community breastfeeding gathering is seen as a best practice by the Center for Disease Control. At the very beginning, my organization got it right. We recognized that breastfeeding is not just peer-to-peer support, it's community support and it's family support. So we created the breastfeeding gathering to bring experts together as well as family and expecting people, birthing people together to learn how to have breastfeeding confidence and breastfeeding success. So we have the community breastfeeding gathering. We were able to continue to host the gatherings during the pandemic, but virtually, of course. And so now we have announced that we are going we have one class that we are going to offer in person. And then we have one class that we're going to have that's going to be virtual each month. We have two lactation specialists that work with my organization. I am a lactation consultant. I have office hours as well. And since the unfortunate formula crisis, we have seen an increase in the number of women who either want to relactate or they want to learn more about breastfeeding and get connected with resources. Our third program, we recently created a community doula program called Re-Rise as a result of a successful pilot program that we conducted for, I think it was 18 months through funding through the Wisconsin Partnership Program. I do want to say that prior to Re-Rise, we did not offer direct services for doulas. We did not, to our program participants for doula services, we did not offer direct services. So when the pandemic hit, we knew immediately without any doubt that we needed to provide doula services to women who were entering into a healthcare system that had changed drastically their maternal care practices because of COVID. So this year we're slated to serve 150 birthing people. We subcontract with a community doulas in the community, about 15 of them. We subcontract with them as our doulas. They are paid for their services. So we can offer this free to the birthing people who are interested in having services. They support moms while they're pregnant. They help identify resources and make referrals for mental health support as well. They stay with the mom during the entire time that she's in labor. And they also provide postpartum support after up to 8 weeks after the baby is born. We just had a retreat last Saturday, which was amazing for birth workers and breastfeeding champions. And I just want to again thank Humana Eye Care for sponsoring the retreat. It was a day of relaxation for our team because they do very important work in heavy lifting. Can you turn to go to the next slide, please? So to share some data and outcomes about the Re-Rise Doula program, this is data that we took in 2021. We're collecting data now through Maternity Neighborhood for this year. I do want to share the data and the results from last year. Last year, we had 90 births. And of those 90 births, 95% were full-term births, which is great. We were really happy to see that outcome as well. Vaginal births were 75%. And it's unfortunately that the cesarean births were 25%. And that is considerably high. So we're looking at ways of why is that happening and how can we reduce the cesarean births. Some of the cesarean births are elected where families choose to have a C-section. Our low birth weight was 13%, which is amazing. And then also only 10.9% of the babies who were in our program was admitted into the NICU. Next slide, please. So my last slide before I share my references is just a word picture of what, through evaluation, what the doulas and program participants shared about the Re-Rise program. They are very grateful and appreciative for the service. Overall, we had great evaluation And we're honored to be in this space as an organization and to continue to provide the services. The next slide shows the list of my resources. And then the final slide, here's my contact information. We could leave this up for a few minutes if anyone would like to take a picture or take down my number for additional and my email for additional follow-up later. So at this time, we're going to open up the session for questions. I think we have like 25 minutes.
Yes, and thank you. You're absolutely right, Dalvari. We've come to the segment of our presentation for questions. So if you have some questions, please put them in the chat. We did receive some questions prior to even signing on for the presentation. And so let me just kind of get folks started here a little bit. One of the first questions, Dalvari, is what's an Apgar score?
So I'm glad you asked that question because it's important to explain to the families as well. An Apgar score is a chart that shows the status, the health status of newborns and infants that pediatricians usually share during the first visit with mom and baby. So it shows the health status of infants and what health conditions they're in.
So that's kind of like a baseline for where the baby is and where parents can kind of see the progress from that point on.
Yes, thank you.
Okay. The second question is, can women secure doula services through the African American Breastfeeding Network?
Yes, our services are free for anyone living in southeastern Wisconsin. The way to access the services is to either go on our website page or to call us directly or email me as well. But our services are free and available to any birthing person.
And how do individual become a doula? Do you offer doula training or do you make referrals to other organizations if individuals are interested in becoming doulas?
There are what we've noticed a number of women in the community who have come forth and expressed an interest in becoming a doula. And I think that interest is escalating by the month or by the day. We do make referrals out to organizations and individuals who provide direct training to women to become doulas and to be trained and then certified. We do not offer, my organization does not provide those trainings at this time.
You mentioned that the doula services are free through the African American Breastfeeding Network. Mm-hmm. So individuals, family members, they just need to call the African American Breastfeeding Network to find out more about those free services. But also, I know there has to be a cost for this. Just for the audience knowledge and information, what is the cost, the average cost to have a doula, a mom and the family?
Well, it is my honest belief, and I know I can stand by this because I had a doula myself. Honestly, that it's a priceless service. It's difficult to now, like, what do we think the value of having a doula? But we do pay our doulas to provide services. I know on a national level and what I've been hearing across the country, that programs, community-based programs like AABN are paying per birth between $2,000 and $3,000.
Okay. And per birth. Okay.
Per birth.
And I'm so happy that you mentioned the formula shortage. There's been lots of news coverage regarding formula shortage.
You're breaking up.
People are looking for ways or information or helping people either at their church or in their family or in their neighborhood. They can also reach out to the African American Breastfeeding Network, for some suggestions and referrals.
Absolutely. Well, we're finding women are calling us and asking, should they water down their formula? Should they add water to make it last longer? Or, of course, where could they possibly find the formula that they were using? But national organizations are recommending that moms can transition to a different type of formula, right? A different brand name of formula, because it's really all the same. And so we're finding women too who are interested in taking our class, our breastfeeding class, and learning how to relactate, or women often call us and say, well, I was going to stop breastfeeding at 6 weeks, but now I would like to breastfeed longer. So what is it that I need to do to make sure that I maintain my milk supply and I can breastfeed for another 6 months, for example?
And there is information in the chat from our sponsor, Kurt Heminger, with Humana Eye Care. So I'll read it for those of you that may not see it yet, or maybe on your phones. For those interested in celebrating moms and babies and advancing maternal child health, join us at the March of Dimes, March for Babies on June 11th at Hart Park. And you'll be able to also see that information on the Greater Milwaukee Urban League's Facebook page. We'll post that. And feel free to visit us on our Facebook page and like and share. We would appreciate that support. We may be giving you all back some time. So I want to thank Dalvari Blackwell for joining us today in providing such informative and real-time, real-life status information of Black infant mortality and the positive impact of African-American doulas. I also want to thank Kurt and Humana Eye Care and their team for joining us, and all of you as well for taking to learn more about the impact of infant mortality, how you can help others in this community. We appreciate you supporting the Greater Milwaukee Urban League and the work that we're doing. Our next Conversation Wellness will take place on Thursday, June 23rd at noon. We wish you a happy and safe Memorial holiday weekend. And with that, we will see you in June.
Thank you.
Thank you.
Thank you. Have a good day.